Corey, sorry. Okay. Okay, we've started recording, everyone.
Okay, so everybody's ready. I'll call the meeting to order at, check my phone here, 9:34. And this is the PABEA Legislative Committee meeting. And we're gonna open with a guest speaker. And Christina, do you want to introduce our guest speaker?
Yes, you guys should have all received Dr. Akiona's bio, but I'll just go over it really quickly. Dr. Kaohimanu Dang Akiona is a Native Hawaiian community-focused family medicine physician, researcher, mother, and advocate for access to rural health care. She owns an independent, integrated medical practice serving rural Hawaii Island and Molokai, providing urgent and primary care, occupational health, behavioral health, telehealth, and mobile health services. Her team has used innovative but pragmatic approaches to address disparities in and barriers to access to healthcare across the care continuum and in a range of resource settings, with a special focus on rural, marginalized, and vulnerable populations. She's also a proud mom to her amazing daughter, Ali'i Kolamanu. I hope I said that.
How'd you do it?
And thank you so much. Welcome, Dr. Akiona.
Thank you. Thank you for having me. So I'm here on behalf of the Hawaii Provider Shortage Task Force and then the independent physicians. So just kind of speaking as we wanted to kind of reach out to people who we feel are, have the populations that we serve, but then particularly the ones that are kind of being affected by the healthcare shortage. And we wanted to share our thoughts and our priorities and kind of like how things, our thinking process as it pertains to advocacy and legislation, particularly because I'm a practicing physician. So it's, kind of based on what we're seeing in the front lines and then what we're seeing amongst our colleagues. So thank you for giving me a moment of your time this morning. Okay, so I think I had a lovely conversations with Dr. Kau'i Fukuda, and we kind of ran through a bunch of priorities at the beginning of a couple months ago. And at the time, we were really focused on a few things. So we were looking at prior authorizations, at network adequacy. Are there enough physicians to serve your patients, to serve your family, to serve you? Primary care protection and rural health transformation. So it seems like a lot. It kind of all has similar themes. Over the course of the last month or so, we really tried to streamline things. And what we really feel like the priority we'd like to share that we feel is most important would be the Primary Care Protection Act. So I'm here to just kind of talk about why we think that's important and just offer myself as a resource should anybody have any questions or have any, any concerns or anything to share. Because to be honest, we understand that the biggest barrier to what we're doing and what we're advocating for is education, both of the public and of the legislators, about the gap. So the gap between what we think is happening and what we believe should be happening, and then what's actually happening. And we know that as practicing physicians in the rural areas, what we think is happening, what we should be happening is very, very different from county to county and very, very different from population to population. So today I'd like to just ask for support in your individual lives and in your organizations for what we're asking the legislators to put forth, which is the Primary Care Protection Act. I don't have a bill number just yet, but I know that we're looking to present this in the current session. So I can say what we think is the PCPA, so the Primary Care Protection Act, it's a critical community-driven solution that we think is important. So we already know, I think many of you already are very much aware, I am as well, that we already had a shortage and the shortage had been getting worse. And the shortage, it's kind of multiple things are contributing to it. So, we're aging, the physician, I hate to admit that I'm aging as well, but, people are retiring, we're passing away, we're burning out. So the gaps in care was getting, wider and wider. Neighbor islands actually have the most severe shortages. And oftentimes our residents, many times the kupuna, predominantly have to travel hours to fly to get basic access to care. The gap is actually, for the provider gap, has actually widened 30% in the last 5 years. And rural clinics in particular are closing at the fastest rate in the state's history. And so part of it, like from the provider side, and I know this is kind of hard, but the overhead costs, over time, it was it was really difficult to serve the populations that needed it the most. That was the Medicaid and the Medicare populations. We were seeing that, basically, they were operating at a loss, and that has gotten progressively worse. The primary care physicians actually earn like a third less than their counterparts in the mainland. And so their overhead costs have kind of caused many offices to make difficult choices in terms of what services they can provide, what hours they can be open, what staffing they can have. It's severely impacting, just access to regular basic primary care. Half of Hawaii's counties, actually more than half, are federally designated HIPSAs, which are provider shortage areas. And I think in that mindset, they thought, well, this would, kind of recruit more people. This would be a good way to help people come and get their payback for their loans, but it's not. What we're seeing is that with the closures and like the limitations of access, there's severe delays in care, disruptions in care. These delays and disruptions in care actually cause significant complications and oftentimes lead to higher cost in care. So when Tutu cannot get seen for their diabetes, and then it becomes an infection, and now we're treating the infection, there's a number of points where we could have intervened sooner if they had more adequately access to care. And what we're seeing is the downstream effects of years of that happening. This has also been compounded by the prior authorization problem, which I think a lot of people have been hearing about in the news. So just the fact that the basic care that your doctor feels they might need is being, overseen by and, approved or denied by the insurance companies. What we see in the rural areas, but across the state, is that women, Native Hawaiians, Pacific Islanders, elderly, and keiki, and pregnant women are disproportionately affected by all of these access barriers. On the provider side, I kind of mentioned to Rick earlier that the provider burnout is at record high. So there's a lot of people just kind of not able to carry on. And this has actually weakened the cultural, like kind of the cultural continuity and community trust. So when people are going to the same office but seeing different providers, that's eroding the trust. That's making people more hesitant to engage with care. And that's tough because primary care actually as a whole reduces healthcare costs when you can do it well. We usually are able to improve prevention. We usually can help them manage their chronic disease management. We can help them with goals of life, quality of life. Oftentimes we are actually the gateway for a lot of the services. So when your tutu is having a hard time, making decisions, and we need to figure out whether or not they're safe in their home, like that's your PCP. When we need you having bad time access to food security, we actually can help with that. A lot of times I'm liaising with the legal side or with the social work side, with the hospice side. There's so many things that actually the primary care team is the hub for. And so for us, we do see that the data shows that every $1 invested in primary care actually saves 13 or more dollars in emergency and specialty care costs. What we are trying to do with this Primary Care Protection Act is to ask that we ensure 12% of the overall spend goes directly to primary care that are providing direct care services. And what we're asking for is that they try to recognize the importance of urgent and same day care as kind of the keystone to having access to your primary care doctor. Because right now our traditional models are just not able to keep up. We just don't have enough of the regular primary care models, primary care clinics that we used to have. What we feel like is without immediate legislative action, I think we all agree, the physicians at least, that we're at this very important pivot point, and things are going bad right now. We are at risk of becoming the least medically served state in the US. And right now the effects are just being kind of softened by the fact that we have a naturally more active, more healthy population. And so we're taking advantage of the good genetics and the good things that we did in the past. But we've reached a point where I think many physicians are more than worried at this point. My ask right now is just that you in an individual capacity or even with your organizations, reach out to your legislators. And if you feel moved to, we'd appreciate the support for this Primary Care Protection Act. This actually does, it works alongside other bills like the network adequacy reform. We are still focusing on trying to make sure that there are enough, like when we say that you have access to primary care, that we are, ensuring somehow that that is actually a true statement, whether you live in Kaunakakai or in Hilo or in Honolulu, that should be true. We are still trying to push forward with the prior authorization reform and some other background stuff as well. Patient rights, we're trying to revamp that and make sure that we all agree that basic patient rights are that, it shouldn't be where you live that's dictating this. There are some things that are already happening with the Rural Health Transformation Grant programs. I know those were mentioned by Dr. Fukuda, and I'm so thankful for her. On our side, just what's been very effective, we know and we see, is when the patients and the patient's family members are sharing their stories with how their care has been changing over time, the evolving kind of like ability to access your doctors. A lot of people have had their same doctor for a while, and maybe they're retiring and things have changed. As much as they love hearing from the doctors, I think it's the most impactful to hear from caregivers, from the patients themselves. It's hard to talk about when you're looking at things that are going wrong, but the more we understand, the more reality, kind of real stories that are coming out, I think the legislators are able to make better decisions when they're better informed. And right now, they don't know how bad it is. And so that's we're asking for some support for the Primary Care Protection Act. And then, if possible, they're saying call your senators, your reps, if you feel like you have good people who want to get involved, share your stories. We did have a nice conversation with AERP. They also kind of agreed, like, the stories matter. And so when it comes to Office on Aging and the kupuna, I mean, I think we have a lot of kind of just aloha for what you guys do and the population you serve. We know we're going to become them soon. So it's one of those, we know that they're most at risk. And so the hardest for us is to watch us not serve the community that needs it the most. Because we see it, like I see it every day. So I see people just not getting the care that they deserve. And for me, that's, I think, what people need to hear about. So I think they can share, I'm willing to share my contact information. And if anybody has any questions or any concerns, or just needs any talking points, I'm more than willing to share. Thank you for your time.
You know how the bill will be written, the language a little bit?
I do. I actually have the full, I can
You do?
share that. Yeah,
Okay.
they have it as a draft. And
Yeah.
so
Okay.
I have the legislative packet, I have the 1-page legislative explainer and the full text. They've revised it a couple, recently, so I can forward that to you.
Okay, make sure Christina gets it.
Yeah, is that
Share
okay?
that with her.
Okay, because I think we have a couple people that are willing to.
Dr. Fiona,
Question.
We have
Sorry.
questions.
Yes.
programs that you're involved with, does it depend a lot on federal funding or not?
I mean, all of us inadvertently do, because majority of us who are still accepting Medicaid and Medicare, right? So we are severely impacted by a lot of the kind of the CMS, the equations, and then, with our private pay, a lot of times, but in the past, it used to be that they would pay us slightly more than that. And now they're tying it to the CMS rates, which like currently are like not covering, they've never adjusted it for cost of living. And that's where we're losing most of the money, is that we want to provide the care, but it's like, I think, what did they say, like 40%, overhead cost rising 60%, and then our payments have slowly continued to drop. Yeah, so in that way we are. I think in many of us, I have a couple of grants. Mine's are mostly with the county and with the rural health people, but they felt the squeeze. I do a lot of telehealth because in Molokai there are no options for certain specialties, and at the time even our flights there were no flights either. So the government shut down, and the expiration of the telehealth benefits for temporarily, we were still seeing people, but we were told just hold it. They did reinstate it, and I think they retroactively are willing to pay, but it was just a bunch of panic. Everyone was panicking because they're just people, different offices were making different business decisions based on whether or not they could afford not to get paid.
So some of your programs could be cut off or shut down because of lack of funds?
So I think what's the most lack of funds. So it's been just basically impacting the patient. So like their benefits are getting cut, their insurance situations getting cut, and they're presenting to our offices with less. So they're saying, like, I don't know that I can pay for my medicine this month. So like, is there what can I do? Because my SNAP benefits or my, maybe their, oh gosh, the other benefits.
Medicaid.
Yeah, they're getting less in their bank account. And so they're, I don't have this much. Is there anything that we can do? So we've been having to try and find creative ways to get them flown over because, it's not always covered for them. Get them food and get them just basic, and that's if they can make it to us because I am Molokai, the healthcare there has really, really suffered. And so the two physicians that were the main doctors who were serving majority of the people there had passed away. A couple of practices closed and two retired. So it was abruptly about 70% of the island just saw their primary care access just kind of disappear. And so if they can't make it to one of us, they can't really troubleshoot.
Right.
Yeah, sorry.
Okay. Hi, so I'm sorry, so the primary care.
Yes.
I'm from Kona.
Hey,
I'm from Kona.
Can I ask you to say your name and where you're from
Yes.
hi there.
for the record?
Yes.
I'm up in Hakuna if you ever need to come by.
Okay, good. I was just wondering, could you summarize what the protections that you're seeking?
So what they're seeking, the key provisions right now, 12% primary care spending requirement paid directly to the treating providers. So not to wellness programs, not to other things. Prompt pay timelines, they're saying 15 days electronic, 30 days paper with automatic interest if the payments are delayed. Because we're getting a lot more delayed payments. They're asking for recognition of urgent and same day clinics performing essential primary care. So just recognizing that primary care is being offered in different areas now. Inflation indexed payment updates and no diversion through administrative scoring. What they're doing is they're down coding us, and so they're paying us a nurse's visit for a visit that was full. And then public reporting and enforcement by the insurance commissioner and MedPA. So just asking for accountability when it comes to the payment. That was for the basic stuff for primary care protection. They are separately, we have a separate one for the network adequacy. So just ensuring that someone is paying who are the people that you're claiming we have access to.
So are the PAs also covered under that?
Physician assistants?
Yes.
So this is for all primary care.
All aspects.
We're trying to say that, yeah. So it has to be, for us, we're saying licensed primary care providers, including physicians, APRNs, and PAs. So it's people that, it's a physician-led movement, but we recognize.
Hi.
Hello.
Marilyn Seeley.
Hi, Marilyn.
Hi. How robust are the nurse practitioners and the physician's assistants, that level of care? How robust is that on Kauai?
I'm not on Kauai. I'm so sorry about that. I'm on Big Island.
Sorry.
Yeah. So right now the community health center is basically staffed with nurse practitioners and a PA. It's a little bit, that's what they were able to recruit. There really is not much. There was a nurse practitioner at the community health center, and there's an MD up there. There's a part-time MD down at the community at the Native Hawaiian Health Center, and otherwise there's me. So there's two MDs and one NP with me. The population is about 7,000. And so the hard part is it's a very complicated, complex situation. And a lot of the disruption in care made them very complicated patients.
Yeah.
So part of me says it's not fair for them to be stuck with just that level of acuity without the support.
Plus, they have to have the supervision of an MD. So if you don't have MDs enough to supervise that level, then
and that's where the accountability you would hope for, right? You would hope we could have a good conversation about that kind of things, but in the rural areas, like I was warned about this when I trained at Pitt, and they told me, and they knew I was coming home. So they said, they told me, be careful. In rural America, medicine is practiced by two types of people who are hiding from things and people with good heart. Be the second, not the first. And so they said, unfortunately, you can get away with a lot of things because rural folk, we don't have as much, just oversight, or we don't even have as much networking. So, I'm a little bit unique in that I still keep my privileges in Hilo. I still, work a lot with the Big Island. I'm like integrated with I used to be on Oahu with Scott Miskovich. So I still have a lot of them. But oftentimes you're practicing alone. You're kind of in a silo, very isolated, and you don't realize, and no one's really watching you.
Are you recruiting for that level of PA?
We are, but the hard part really is I'm an independent practice person, and so I asked the state for help to support, because actually people want to work with me. So I'm in a weird situation where people are asking me to serve with me over there if they like what we're doing. I have to be able to afford it. And in order for me to afford it, I have to be able to float them for about 6 to 10 months as they build up their own panel.
Yeah.
And that's about $250,000.
Are you getting influenced by the decisions made by CDC and the National Institutes of Health?
We are independent. So I mean, I'm pretty well trained. And right now, I keep in touch with a lot of my friends who were there. And so right now we are following our medical guidelines.
Are you getting questions from patients who are reading all of this stuff?
It's
this
been
stuff,
hard.
Bad stuff that's coming out.
So I will say, like, that's part of the thing that's making our job so much harder is the misinformation and the fact because they don't have good access to care, they don't have, I was thinking about this. So I had a lot of 40-year-old male patients who suffered really bad complications from COVID. And the majority of that was because they actually had no primary care. They had their pediatrician sometime, and then the best medical advice they could get was maybe from their coaches, their softball team, or their MMA coach, their MMA, they were working out. And that's not a bad thing, but it can be when you don't have a trusted medical professional that you're just, and that to me is a failure of the system. So I'm trying to be, because I try to serve everybody regardless, but it's been getting harder because they're really set in this, and constantly that revolving door of providers is not helping us either. So they don't trust us as much. And then it's kind of just, oh, well, you're getting your influence. And it's like, no, I'm influenced by watching people suffer. I don't want you to suffer, but it's been getting harder because I'm outnumbered by the disinformation. There's a lot more people out there than there are of us, because we're less and less. So
Every country, and we visited an awful lot of third world countries and looked at the medical care on a neighborhood by neighborhood basis.
Yeah.
And, Cuba has neighborhoods with a primary person there
Yeah.
who has maybe some medical training, maybe not, that monitors things, particularly about pregnant women. I was in China with the barefoot
Thailand
doctors. I
too.
was treated by a barefoot doctor.
yeah,
And,
there's like
certainly that's not
training.
ideal.
No, but that was a good
But
model.
they're out there in the community, talking to people, giving health education information.
When, to be honest, that was part of because I was not going to be a doctor. I was a researcher before, and my original focus was creating the cancer patient navigators. And so the community health workers came out of that. The idea was that those people would be the lay folks, the normal everyday people in your community who would be the extenders of the medical team. They would know enough to know when to send them out, but they would also be trusted enough because you're at everybody's baby luau, you're in the community. So that was the idea of the model. It didn't happen that way, but that was the
Is
idea.
that still in the works to try to
It's
develop?
hard because they pushed us away. So we're not at the table. I think in order for those kind of things to really be as effective as we want them to be is to have a strong physician as a part of it. Being at the center of it with the patient. You can't do it without us.
I was
And
gonna say, if there's nobody to send anybody to,
yeah,
then,
Yeah.
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 And that's where
Plus,
on our
the
side,
supervision is
Right,
extreme.
right.
it is, because there's a lot that we see, right? So
And those folks need to be at the table. helping
Yeah, we
make
do.
Decisions,
Yeah,
like we are here.
Yeah, so
System
thank you
is
for having me.
For the
And that
richest
was why I'm
country
here.
in the world, our system is horrible, it's broken,
is,
it
yeah.
doesn't serve us at all.
No,
And,
sorry about that.
and it starts at the top.
So I'm gonna move us forward. I'm gonna say, because we can go down this rabbit hole too easily. We got all day. Pace yourself.
I'll hang out with you guys.
Yeah,
still,
yeah,
so
yeah.
I'm here.
Yeah,
Well, do you want to check if there's any other
well, I
questions?
don't see any.
Okay.
Yeah, you don't see any, right? I didn't see any.
no.
Oh, I-
Anybody on Zoom land or in Zoom land who has questions?
Questions for the doctor?
Hi, Erin, I see you.
No? Okay.
Hi, Kohi. Thank you for
Um,
doing this.
Okay, so what we are doing here, this committee is, we're really just listening to possible bills that folks are going to end up supporting and doing testimony on.
Okay.
And so this will go into the queue, if you will.
Thank you.
And then we'll end up probably January, beginning of February, hopefully voting on which ones we're going to support. And then we're gonna bring that to the full PABEA group. And then, so the goal is that everyone that wants to can write testimony to it.
Oh, that's so helpful.
So, and I'll just say personally, because I was a field med corpsman, that's how I got here. Actually, December 10th, 1976, I landed at PABEA.
Oh my
The
God.
field med corpsman, and I ended up being the petty officer in charge of the mental health clinic.
Oh,
But
Yeah.
wellness is a
Are
whole
we
thing. of-
moving forward?
We're gonna
Yes,
move
we
forward.
are.
I'm gonna make one other statement. So what I've seen here in Hawaii happen, and maybe it's across the nation, is a lot of folks, they're no longer taking any coverage.
Yeah.
to become a concierge.
Becoming concierge,
And my
I don't
previous
feel
doctor
it,
just sent me a
but-
letter to go that direction.
because it's so hard to deal with insurance, and I don't want that to happen, and we're hoping this is one way that we could maybe encourage the remaining few of us to
Right.
not go that way.
Do you think that's gonna be hard for people to afford, right?
So in a true model, it would work, but I think like it would, with right now, it wouldn't help the Medi right now, and that's what I'm concerned about.
Right.
We want
Okay.
them to.
Good luck to you and
Yeah.
thank you.
So we're gonna be back in touch with you, I'm pretty sure.
That's fine.
You'll just share with me and I'll share with everybody.
Okay.
Yeah.
So any of the info.
And we can, Christina, we can go wider, we can share it with all the PABEA folk, the folks that are
Thank you.
here, so.
Thank you.
Because even if PABEA doesn't, if somebody doesn't pick it up, we can, as you mentioned, do individual.
Individual, if you feel.
I'm involved in a lot of individuals, so.
That's helpful. I mean, I know the providers, the provider shortage task force is really grateful for any of the support, because they're all doing this on their own time too, so they're all like rough around the edges. We just.
So I'm in 20 nonprofits. If there's other ones that I think would be important for you to talk with, are you okay with that?
Yes,
Okay, so I'll be in touch.
thank you.
Okay, anything else for the doctor? No, appreciate your presentation.
Thank you.
Good luck. This is so important. Okay, so with that, I guess should we just do roll call?
Just check the time. Okay, roll call, Poki Balaz, absent. Bill Kanaka. Stephen Lung,
Here.
see you, Stephen.
Mm-hmm.
Sarah Maderos. Shelley Ogata.
Here.
Susie Schulberg is excused. Marilyn Seeley. Barbara Service.
Here.
See Barbara, thank you. Gary Simon excused. And Rick Tabor, our chair. Community members, Charlene Eboshi, absent. Joanne Kealoha, I saw Joanne.
I'm
Sure.
here. Here.
Your name?
Oh, hi, Joanne.
Hi.
Thank you. Roberta Murray.
Here.
See Roberta. Kathy Wyatt. Absent. Sarah Yuan. Absent. And then we have the triple A's. They're in a meeting right now. So Emily, Kau'i, Rowena, Derek. And we have Erin Samura also with us today. And myself, EOA staff. Anyone else I missed? No? Okay, and you've got quorum.
Okay, fabulous. Okay, so I guess I have to review the protocol procedures every meeting, it looks like here, so I'm just gonna do that. So as I mentioned earlier, this meeting is being recorded, so think about what you're gonna say. A quorum of the board members is required, which we have. For you guys on Zoom, if you're part of the committee and PABEA, you need to leave your cameras on. And if you need to step away to use the bathroom or something, let us know. So we have to put that in the notes. If we don't have quorum, then the meeting is canceled. Sometimes we just check in, but we can't vote on anything. Okay. Raise your hand if you want to speak, wait to be called on. And identify yourself. So I've noticed just now, and I've noticed throughout, and all of us do it. If you just say who you are, then that can get into the notes. It's a lot easier for Christina and AI and everyone that's tracking it, okay? Let's see, what's this? Correction on expectations for oh yeah. So I last meeting said that if you're not feeling ready to support a bill, or you don't feel like you want to for some reason, I said it was okay. Actually, the bylaws say we need to pick something. So everybody on the committee needs to choose a bill to support. So what I'll say is choose a bill or even a couple of bills that you feel passionate about. And then again, as we do that, so what we do is as we write a testimony, we ask if you could please share it with the rest of the team so we can kind of see what that was. And then that'll spark, if you will, what we write as well. Okay. The people that are assigned, and say that they're with PABEA. If you're not assigned, then we have the preamble that you need to say that you're with PABEA, but you're speaking on behalf of yourself or, on the bill. Okay. There's an actual, at the end of the agenda, it's actually written out. So this time at the end, I'll read it. And then the next part is, so we have the minutes that was sent out. Well, hold it. There was one thing that was in here that I saw. So we didn't have, Christina, we didn't have a RAC meeting yesterday. Everybody was in another
Okay.
meeting, so I postponed it. So that's just one, that's the only change I saw. Anybody else have anything that they see in the minutes that needs to be changed? If not, I need a motion to approve the minutes from November 7th.
So move.
Okay, a second.
Second.
All right,
Any objections?
okay. Okay, hearing no objections, the minutes are approved. On to the next stuff. Let's see here. So guest speakers, so we had a great guest speaker today. So, who would like to speak in January, so I'll just put it out, there is, Colby Chalk from, Director of Public Policy and Advocacy for Alzheimer's Associations. He's ready. I'm one of the champions, so is Kathy, so is Barbara. So we're ready to kind of put out what bill they're looking at doing, and, so I'd like a motion actually to approve having him come in January unless somebody thinks somebody else takes preference. Everybody okay with Kobe coming? Do I need a motion for that, or is it just,
You can.
okay? Okay, so moved. All right, everybody in favor of having Kobe Chalk, Alzheimer's Association present at the January 7th, is that what it was? No, what's the date? The January meeting?
Well, we've got to discuss that.
Yeah, we got this one. That's right. Okay. All right, well,
Second motion, sorry.
okay, second motion. Anybody?
Abe.
Kobe,
For Kobe.
okay,
And Sarah.
all right, thanks, Sarah.
Sorry.
Okay, anybody object to that? Okay, hearing none, I'll invite Kobe. Now, if for some reason something comes up for Kobe, we want a second, we should probably have a backup. So we have on the list here, there's several things we talked about here. So one of them is Representative Lisa Martin. She's the chairman of Human Services and Homeless Committee. So I haven't talked to her, but that's one suggestion. Connie Mitchell, who's a good friend of mine, and my wife graduated with her in high school, Roosevelt graduates. Executive Director of Institute for Human Services, and she's kind of the guru of homelessness. I could invite her if we want. And then a newer friend is Tori Carapello. She started the Hearing for Hope. I've talked to her about her before, doctor. So she actually woke up during COVID, unable to hear, and ended up with a cochlear implant, and then started Hearing for Hope here on the island. So we actually she has formed a task force that I've joined, and we'd like to talk about that also. And we already got folks that are going to sponsor each of these bills, actually. I'm not sure about homelessness, what bills. We'll talk about that in a little bit. Which one of those would be a good January backup to Kobe? If Kobe's on.
Lisa.
To Lisa?
Yes.
Everybody? Okay.
Yeah.
All right, everybody okay with that? So if I couldn't hear it, so the suggestion for a second backup, for a backup to Kobe would be Representative Lisa Martin, Chair of Human Services and Homeless Committee. Okay, everybody okay with that?
Okay. And Sarah Yuan is joining us.
Oh, okay.
Hi,
Okay,
Sarah.
welcome, Sarah. Sarah, so
Hi.
we that's already. If you see anything you want to change, let us know. And then we suggested for January speaker to have Colby Chalk, Director of Public Policy and Advisory for Alzheimer's Association as our primary speaker. If he's not available, we just came up with Representative Lisa Martin, Chair of Human Services and Homeless Committee. Okay, you're caught up. Oh, and you missed a great presentation, so you'll want to watch the recording of that. All right. So I tried to get the top 5 bills from Kapuna Caucus, but they were still voting on them. So usually we have them, I've been able to get those much sooner than today. So today the Legislative Kapuna Caucus will meet at 2 o'clock, 2 to 3, only on Zoom. And we last in December, they pitched how many bills? At least 15
Yeah.
bills, and they're gonna
Four.
be voted as a caucus on the top 5. And so those are gonna be announced today
Oh.
at
you
2
don't
o'clock.
want them.
I could not get them.
No,
Although
they were still telling.
Anybody on the email trail knows, I certainly tried.
I think, Rick, too, that individual legislators can still introduce bills that are not in the top 5.
Absolutely.
Right? So, I mean, that gets the full support of Kapuna Caucus. But if there are other bills that individual legislators particularly are interested in, they will push
Oh.
that as well. So,
There will be many bills introduced.
yeah, beyond just the top 5 and
Right.
go after those that we think,
Yeah.
are really important. Everybody
Yeah.
tries to narrow it because it takes so much energy to try to follow 100 bills.
It
You
is.
kind of get lost in it. But to get it down
Yeah.
to just a number that you can really put your whole heart into
Yeah.
is
Yeah.
preferable, but it's not exclusive.
Yeah.
Yeah. And so here we decided that we're not gonna put a number on it. We fell around 8, but we're going to leave it flexible. Each of us on the committee should choose 1 or 2 bills that you're going to follow. I wouldn't recommend I'll probably do 3 myself just because I'm on all these other committees and stuff. One year I did 18, it about killed me. There was no way to stay caught up because it doesn't tell you when you get an email what bill it is. It just says here's a message. So you get buried with all these messages. But here, so we're being very careful and deliberate about which ones we're going to support. And I start with the Kapuna Caucus because most of us from here join the Kapuna Caucus and they'll choose 5 today. They also don't just do 5, they'll have resolutions that they're going to support as well. But we'll hear the top 5 today, and so in January's meeting, we'll know what those are. But what I would suggest is today, as you're listening to the Kapuna Caucus and which bills they're supporting, if it's one that Barbara or Gary or myself or Marilyn haven't already picked that we're supporting, hear what that is and as to whether it's something that you want to support, so we can dive in a little bit deeper and then start to follow those
And who
things.
knows what's gonna come up? I mean,
Yeah,
in this state, the sky's the limit.
Right?
yeah,
The more bills, the better,
yeah.
for some strange reason.
Well, there's a lot going on out there, so let's see, so what else do I have here? All right, so just think about that, which bills, as you hear them from Kapuna Caucus, you're interested in supporting. And even if one of us is already supporting something, you can always join us, the more the merrier. And frankly, we should, if we can, write testimony on as many of these bills as possible. You don't necessarily have to be following it. Our ace in the hole is we have Christina, who's great at getting the information out to us. So in addition to tracking it on your own, we do have a safeguard here, where she's got it, you really have a great way of spinning it out to us, so thank you. Okay, so my first is review and discuss, have a discussion about current and pending 2026 houseless related legislation. So I've done a little bit of research. I've done some emailing with Sarah and Christina and Carolyn, Beverly. So existing in 2025 legislation and funding review, current legislation and measures. Okay, so Act 282, HB 703 was enacted in 2025. Am I accurate on that? Yeah. And it extends Kapuna Rent Supplement Program through June 30th, 2028. If I remember correctly, Rep. Chun was very active with that one. Isn't that what he told us when he met with us our first meeting?
Right.
Okay.
Is that the one only for Oahu?
No.
No,
Oh,
Hawaii.
Okay.
Statewide.
Okay.
Can I add to
Please.
that?
Yeah, please.
And that, my understanding
So
is
introduce yourself, please.
Sarah Padera, Kona. It's not just for rent.
No.
It can help with other expenses having to do with housing. In other words, help for, well, I'm not sure about this specifically, but help with mortgage, help with, tax-related kinds of issues.
Okay. And do you remember,
Just
you
with
guys,
the counties.
is there something we're doing with that this year? No.
It's,
Okay.
it's passed.
So that's
it's good.
passed, that's
Yeah.
enacted.
Good until 2028, so
Okay.
probably around 2028.
We'll have to look at that.
Yeah,
Okay,
But I think it's important because it's a misnomer when it says it's just for rent supplement.
right. Okay, well, good clarification. State executive budget includes general funding for houselessness initiatives in SFY 2026 and 2027. What do we know about that one, Christina?
I don't really know too much. A lot of it has to do with, I believe, the transitional Ohana. There was, a lot focused in terms of the budget on those services and programs. But I don't know too much.
Okay.
So,
So we can look a little more into that.
Can I say something on that?
Please,
My,
you're heading up this one.
okay.
That's why I'm sharing this
My
first.
understanding is that, especially on the neighbor islands, they're at full capacity,
Right,
which means that we're
Can't
going to
go.
have to be creative in providing shelters for people. There aren't beds available.
right,
So one of the things that for this idea of transitional, meaning that you can park your car in a
Right.
place that provides access to
Security.
kitchen and bathroom and so on.
Hmm.
So that, believe that is part of the initiatives in the different counties, at least on the Big Island, from my understanding. Is that when we say transitional, the terminology is expanding.
not necessarily shelter, but
Shelter,
the
but
services to
Services to
provide.
provide,
the-
you bring your own shelter.
Mm-mm.
right. Okay,
Somebody's thinking out of the box. Yeah.
okay.
We got it right out there.
Got it.
In Kona.
So then last year, here in the state, they tried to introduce, and Christina helped me out with this, it actually didn't go very far. This is Mike Juliana, the mental health and involuntary treatment measures. I'm just gonna say, I started out in the field when we started deinstitutionalizing back in 1975. We've never provided adequate care for folks. And folks that, I'm sorry, we have two sides going on, one that wants to save money and put money in people's pockets, and the other that wants to help people. So those sides, as the power shifts back and forth, in my profession, so mental health profession and social work is the lowest paid profession in the United States of America because of those changes. So it's very hard to keep our staffing, and turnover is high. So what they try to do and what they have started to do, so I have two parts to this. So in the state, this didn't go very far, but I'm afraid it might get reintroduced. And I'll assure you, I'm on a Samaritan Counseling Center, Hawaii's board, and I'm also past president now of Bobby Benson Center, which is mental health. And I've joined a couple of other mental health programs out there, AFSP, American Foundation for Suicide Prevention. I just kind of got roped into, and I'm glad, some of their policy and procedure kind of process. The issue is that they're working on being able to commit people a lot faster and take them off the streets.
Commit
is how
to
they do
where
it.
though?
Yeah, exactly. But so there's all of this. So last year, HB 1225, if you want to look it up, amends existing statutes of Borden, what is that? Broaden, and to broaden involuntary treatment commitment includes revising the definition of danger to self, defines gravely disabled, so redefines gravely disabled, psychiatric deterioration, and broadens the term immediate, imminently dangerous to self and others, and increases the period of emergency hospitalization, allows physicians to advance practiced registered nurses and psychologists to hospitalize an individual to a psychiatric facility for emergency hospitalization. Now you go one step further. So Mr. Trump signed an executive order on July 24th, ending crime and disorder on America's streets, encourages states to expand civil commitment laws to allow for involuntary treatment of individuals with mental health and substance use issues, experiencing homelessness. So I put this here, Sarah, because we keep having folks say that most homelessness is mental health, and that's not the issue. But this would open it up. So I'm gonna go a little bit off the record. So back in the day, what rattled me and caused me to go into the whole mental health world in the fields was seeing a movie called Frances. And it was based true story in Seattle. And it was somebody that was a bombshell in the movie industry, and she wanted to have regular roles instead of all these bombshell kind of roles. Her mother had her committed, and all kinds of horrible stuff happened. So Jessica Lange got a Academy Award for her portrayal of this
Expensive farmer.
very intense movie. And it was based in Seattle, which is where I ended up working at Seattle Mental Health for 30 years. So I actually heard a lot about this, and this is why we don't want to go this direction. But that's I'm stating my opinion here for the record. I'm not representing PABEA on that. I'm representing myself as a 50 years in the field of mental health person.
So slippery slope.
Very slippery slope. So I can guarantee you, if these bills start to go forward, I'm gonna jump on board whether PABEA does or not. I'll just say that off the record. So homelessness, that's my little section of little research that I've done in our talk. So there's a lot more to come up. I'm even gonna say maybe we have Rep. Lisa Martin come the following month. Because then the bills will already be out there and she could speak to that for us.
To be busier.
But she'll be busy.
She'll be really busy, so I don't know if it's gonna work, but
Later during session.
I can put a plug in though for her.
She might.
She might want to, because she can zoom in. It's just 15 minutes.
Mhm.
Yeah,
Just
so
15 minutes for
I'll-
legislators.
yeah, go ahead, Sarah.
Can we add the word vulnerable in there?
Yeah,
Vulnerable, older, vulnerable adult.
well, I took these are direct quotes that I took.
I know, but if we
But-
can encourage
Of
the
course.
use of vulnerable,
Yeah,
because there are many who are on the teetering edge.
Yeah.
That may not be,
yeah, we can add that, and as,
That's actually the problem.
that
Yeah,
is the
it
problem.
is
The
the problem.
Alice folks,
There are-
because we have a lot of effort going towards
Yeah.
once they're homeless, but it was like everyone is existing as an Alice household.
yeah,
And that's actually probably the better use of resources, but the insurance company is telling us we can't focus on them until they have a problem,
yeah.
which is a problem.
Well,
Well, that's-
vulnerable.
Yeah,
So to that,
and it's a medical issue.
that's the issue in mental health as well.
Mhm. They, like,
We
you
don't
didn't
come
put
up, if we
someone-
don't come up with an acceptable diagnosis, so I had to switch diagnosis stuff because stuff ended up not being covered
Yeah.
as the managed care world came into being. I'm gonna share with you, one of the most alarming things that happened in my field, I was the first to be licensed at Seattle Mental Health, where I was at for 30 years, and this can be on the record because this actually happened. I was in a managed care training meeting for, this guy is the medical director for Swedish. And at the time it was called Medallia. And the managed care company, the psychiatrist said, if you end up requesting more than 15 sessions, we're gonna electrically shock them because that works. And I freaked out. I was like, are you kidding? Yeah, but it also loses, long-term memory is gone and it doesn't hold. You gotta do it over and over and over. Kind of stuff, but that's the managed care world. So again, as long as for-profit is what's driving, if that's what they see as success, then folks that are vulnerable are going to struggle. So anyway, I think these are really important things to consider as we look at our bills. So I'm gonna move on. Anybody out there have anything? Zoom land, anybody? No, okay. All right, so review priority areas, issues and concerns. So we did this, we've gone over this. So one of the main areas, so you guys asked for a little outline of what areas we want to categorize it a little bit. So the number one issue here in Hawaii is high cost of living, right? So it impacts housing, food security, all of that. So yesterday I was reading, did I send it to everybody? The city and county has voted to make for a Bill of Right, food security, one of their top bills of rights. So I'm president of Hawaii Meals on Wheels, and that's a huge issue. So what was it, 2 weeks ago, 3 weeks ago, came out with an article and research. So in Hawaii right now, 32% of folks have food insecurity. So in addition to houselessness, food. And so I go to the Maslow hierarchy, and the number one thing we got to focus on is food. food, shelter, safety, right? Before we do other things. So that's a huge issue. Healthcare workforce shortage. So in addition to what our great doctor here just presented, just yesterday, another executive order turned nurses into a non-profession, and they're no longer going to relieve them of their student loans if they serve rurally. That happened yesterday
Beautiful.
at the federal level. So we're focused on,
Yeah.
Teachers too.
well, teachers happen,
They don't-
that was earlier.
Well, it's true.
That's,
true.
so that's federal level.
Mhm.
I think here in Hawaii, one thing we do that we are fortunate is that our governor, who's decided not to run for president and is gonna run for governor again, is a doctor.
Mhm.
So hopefully we have these things prioritized here and can work with that. So that's just again, my opinion, but, it tends to lean in that direction. So we've already got a workforce shortage, including doctors, nurses, paid caregivers. I'll put all of them in there. So there will be bills around those kinds of things that surface, as we already know. Affordable housing prices, critical issues for Kapuna on fixed incomes, Kapuna rent supplements, we talked about that earlier. Food insecurity, so I just covered that. There's a whole SNAP thing going on, Supplemental Nutritional Assistance Program. So just for the record, even though the shutdown ended, the budget is still needs to be handled. So December 31st, some stuff's changed. It's January 31st, other stuff changes. So we're still very much at risk of having to deal with many folks. We've already at Hawaii Meals on Wheels, I think at last count, there were 30 folks that have lost their benefits that we're trying to cover. So it's out there. The state did a great job of putting a grant out there that many of the programs I work with got some funding so that's temporary. I mean, but at least that sustains us for a little bit till we figure out what else we need to do. Shortage in caregiving and health resources. So long ago, I discovered loneliness and social isolation is a huge risk factor for both physical, mental health, and suicidal behaviors. There's been research that showed that Alzheimer's skyrockets with isolation. So, and of course, everyone here knows that for 8 years, I've been working on hearing aids, making them accessible and affordable. I see that as a huge issue with isolation, social isolation, and a lot of the stuff goes on. And I kind of tongue in cheek, jokingly say it's something that you don't see, so it's not heard. People look normal, so you don't see that they have an issue. You wonder why they're not hearing you. But for them, it's embarrassing, so they don't go out. And I'm going to expand it. This isn't just Kapuna. Kids are born with hearing issues. There's hearing issues for every generation that's out there. It's a huge issue. Growing super age population, increased demand for resources, exasperated by housing prices, driving away younger caregivers. We had a couple things going on there. High cost of living, so a lot of our youth with real brain drain, in places, a lot of rural areas, but definitely Hawaii and people living. So we don't have enough folks out there to help. I'm hearing a lot of stuff from programs, in-home care programs. Hard to find caregivers anymore because the immigration issue stuff going on. So there's a real shortage. I might have shared in here, but when I was doing in-home care as operation manager, I would say it would take 15 referrals before we had one that could actually afford the services. And a number of families would just send for other family to come to care for they can't do that as easily anymore. Alzheimer's and dementia. So they passed Act 283 for training healthcare providers. And so Alzheimer's Association is still looking to kind of do more around that. They also passed last year the what's it called? The mini cog assessment. And so trying to expand more around that. And then a bigger concern, I didn't realize this until a couple months ago, we passed the silver alert that if someone disappears, getting it out there for folks like on signs in your phone and all that kind of stuff. That's still not happening. So so Kobe will talk about that. You guys are doing a great job. Yeah. And the beauty of the silver alert is the research showed that they tend to find folks within 4 hours of that going out versus 4 weeks later and not surviving. And my personal story was my mom in North Dakota went out in 35 below wind chill, and she ended up being found many hours later and lost fingers and toes that were frozen. It was horrible. Health infrastructure, access to care, especially in rural areas, potential impact, Medicaid, Medicare, these are all the things that you just talked about and those challenges. Those will come up for the state. I don't know what kind of bills we'll be seeing around that. So do it just for the record. So they have till end of January to submit to sponsor the bills. So really by February, we'll kind of know what's out there. Right now, our focus is really just hearing what bills there are, and if we need to and can check in with our legislators, it's a good time to do that, to see what they're going to be doing. So caregiver shortage and burnout, need for more healthcare services, adult care, respite. Hawaii was designated a high-risk state for family caregiving. So we have a number of families that are caring for their caregivers and not getting paid anything and losing, basically giving up their careers to care for mom and dad or even a loved one. And then specialized youth care, challenges for child development when children become caregivers for Kapuna. Those are all areas that we had of concern. So what bills surface around those, we'll just wait to see. Safety and security issues. So we've heard from AARP and a number of venues, consumer fraud scams. One of their big areas in a bill that they're going to present is around crypto currency. Apparently the ATMs are all over the island right now, and people are being
Tricky, yeah.
I think they said 1.7 million just in Hawaii just in the last year. And it's not just Kapuna that people are being ripped off. And if you get ripped off for a cryptocurrency for a machine, there's no reimbursement. You're just out the money. And so they have a bill that they're going to present, hoping to help with that. I think it was like over $1 billion nationwide.
Yeah.
A lot of the rules and regulations were relaxed as this new administration came into being. Access to technology. So this may be definitely in the rural areas, it's an issue. We had a company that came from Seattle that just spent 3 days in Molokai, and they told us that they couldn't access any information. They couldn't get their internet to work. So we still have a lot of those spots that are out there. So there's going to be bills to increase that are going to be out there. So Hawaii specific concerns. Again, we've talked about houselessness. So address the 87% increase, 5,414 more people in homelessness, 2023 to 2024, need for affordable housing, financial assistance, senior shelters. One of the things that I discovered, because I was involved in the Hompa Honganji and did a statewide conference, is a lot of our temples, a lot of our historic buildings, they can't afford the insurance. It's unaffordable. We had Scott Psyche come and talk about that. It's a much bigger issue than most people realize. If that hurricane that's predicted to comes, things aren't going to get fixed back up. But that's an issue for individuals and their homes as well, right? Marilyn, was this yours, the burial sites, sensitive cultural issues regarding the handling of ancestral remains?
Yeah, I've been involved with that with Colin,
Yeah,
and he, I think he put it in, he got it out there in the newspapers and things, and it is a concern to legislators. And all we're asking for is just transparency and what's your contract and who does what to whom
right.
and who owns the body. I mean, really basic things, and mortuary is objecting to that. And we haven't heard specifically all of their objections,
Okay,
but I think it's something that everybody ought to know about.
right.
We don't like to talk about that. We don't like to talk about just like the disposition of our family members' bodies.
Is
and
that-
things, but it's different, very important, and no
Right.
sense in having great conglomerations of mortuaries making a ton of money.
So what you're talking about is like the gold in your teeth and the
Precious-
metals,
precious-
those kinds of things.
There are
This,
precious metals in joints and mouths.
this one though is the burial sites,
This is for EV Kupuna.
yeah.
Yeah.
And
And so there's a working group right now. The legislature has a working group
Okay, working on that,
working on this right now.
okay,
I'm not sure if they're gonna have any
yeah,
legislation
yeah.
coming up
okay.
with recommendations.
So we're unclear what's gonna be introduced as a bill or not, so just going over the areas that, you know, of concern. So our next meeting, maybe we know more, but definitely the February one, we should have a better idea, right? Do you think, Christina?
Yeah.
Yeah, okay. The other older adult issues, Kapuna issues discussed from prior meetings, so that we've had, long-term care, master plan, SNAP. So that was, Rep Chun, so Corey Chun was talking about that with us, the very first meeting that we had. 2025 legislative outcomes for future opportunities discussed by Senator Morawaki at the I'm gonna have there September 5th. So bills have kind of gone like fireworks. We have somebody in our neighborhood that's doing that again. They're not fireworks, I call them bombs. Traffic safety, houselessness, condo insurance, caregiver tax credit, SNAP funding, paid family and medical leave, hearing aid coverage, just have a laundry list here, mandatory hearing tests. So the thought there, is I have a doctor here, is that at age 55, when folks come to their annual physicals, that they actually have a hearing screening and then referred on. And there's a task force that I'm in that's just getting started. So we're gonna sort out, should we do that every 2 years? Should we do it every 3 years, annually? Supportive and caregiver-based communities. Sarah, do you want to say something?
I do.
Okay,
With all due respect,
yeah,
can we try to keep our meetings focused on Kupuna? So that churches and temples and this other fireworks and all the rest of that, can we start really focus on?
Yeah.
And
So
not
chur-
spend that time.
so with all due respect, right back, churches and temples is where our Kapuna go for many of their services and where they hang. I was just on the board for Hompa Honganji for 3 years. It's mostly Kapuna that are hanging there and programs. Fireworks are disrupting folks of all ages in fairly negative ways, but okay, we could take those off.
I'm
if That's
just
what the
thinking
committee
that,
wants.
there's so many issues
Yeah.
having to do with.
So right
health,
now, Sarah,
safety.
with all due respect, I'm covering everything that's out there. And the hope is that folks hear something that they want to take on, and then we're gonna narrow in on those and not all the other stuff. We don't know what's going to be presented, and I don't know what some of you newer members want to cover. So I know you with homelessness, and I know Gary and Barbara at the ARP kind of stuff. I know what I'm going to cover, right? So I'm just, with all due respect, with the time that we have, trying to cover everything that's out there. And so the other piece is that we are under sunshine law. So if you have something and we send it out, if you see something that needs to be done differently, we need to know in advance, because once we send this out, we're locked in. And we can't add different things. So,
I'm
Well-
suggesting subtracting.
yeah. Okay, I hear you. All right, well, I'm gonna stop there then. So okay, so this is the part where you actually, so we could do less. We could do others that we did not cover here that you think is important. But I need to know what those are so we can get them on the agenda and cover that. John?
Hi, John McDermott, long-term care ombudsman. I don't know if Christina brought up the issue about the EV bill.
No, no.
Oh, okay.
It's
So,
not on here, so,
yesterday,
sorry, we can't discuss it, it's not on.
But email me so we can get it on
Well,
the next
we
one.
can get it on for the next. one.
That's the issue here.
Okay.
Sunshine law, we have to say what's on the agenda, and it's not on the agenda.
Yeah.
So,
So part of the reason there's so much,
proposals for bills, right?
yeah, but it wasn't one of the proposals, I don't think so, but
Isn't this meeting to generate proposals?
yes, John, but the point is that we are required under sunshine law. There's requirements where we have to list it onto the agenda. So if there's a specific topic, it has to be on the agenda. And if it's not, then we can't discuss it.
So one of the reasons that I have so many things on here, I want to make sure there's enough on here that we can talk about. Sorry, John, email it to me so I can get it on the next one.
We can add it for
So
January.
each meeting, we've suggested, Christina and I, email me if there's something that you want on the agenda, so we get it on there. So what I did with this one, because we're getting ready for the bills to be introduced, is I put everything I could think of in here, so we didn't run into this.
Mhm.
That's why there's so much here. Now, when the bills are introduced and we decide what we're going to be covering, then we're gonna go very specific into, Sarah, what's happening with Bill HB 235, you know? Right? So then we get much more specific as we go forward. My hope back at the beginning when we started the committee is that if you had something you're passionate about, that we could actually go over and meet with the legislators. And so I've been doing a lot of that with other folks in other committees like Alzheimer's Association and the Hearing Aid Task Force. And I'm going to be going over to the mental health group, meeting with folks and getting the legislators' feedback and buy-in to it. So again, so going into like next year, we'll try that again. If you have stuff that you see, maybe a bill that you wanted, like hearing aid stuff, for instance, that's going to get reintroduced. I like to, during the off session, go visit with the legislators and hear, so what happened? What do you recommend for next year? What do you think? Right?
So Rick, I just wanna just backtrack a little bit
Okay.
and suggest with the guest speaker, we can, if you're interested, bring in DD Council.
Yeah.
Che is the legislative coordinator for DD Council, and they do have several bills that.
Developmental
Oh, I'm
disabilities.
sorry, Developmental Council on Developmental Disabilities, also known as DDC.
Mhm.
And so it can be, he's pretty quick, so if you want two speakers in January,
Okay.
they can go over their priorities. Some of their priorities do impact.
Who said that?
It's Daintree Bartolis, is the director. And then Shay and Silvert is, their legislative coordinator. So
Okay.
yeah, so if you guys are interested, I can ask him, and maybe Kobe and, because they do have some
overlap.
bills that will impact that
Mhm.
I think folks will want to, or will be interested in.
Well, like the Silver Alert, we team with them to pass that. So there is overlap.
Historically.
So,
Yeah.
yeah, they're great. They're great. So.
Would the committee like us to do that? We extend a welcome to them also? Same thing will happen next time. We won't have all the bills yet.
And I didn't add it on because I just heard last week they find, I guess, what their priorities are. So we've already did the agenda by the time.
Yeah.
We knew, so.
Yeah.
So are folks okay?
Okay, everybody out there in Zoom land okay with that? We'll add two speakers for next time. Shay from Department of Disabilities.
From
Developmental
Council on
Disabilities.
Developmental Disabilities, Chase Silvert, who's their legislative coordinator. And if he can't, then Daintree, who's the director, the administrator,
Yeah.
probably can as well, so
Okay,
do that.
all right. So everybody sees the preamble there? And then again, agenda items for next meeting. I think that's why John was bringing that up. We'll add, so make sure you get that to Christina and I so we can add that to the list. Any new business?
Wait, sorry, to make that.
Oh, I'm sorry, she has an announcement.
Sorry, Bill.
You told me earlier.
Caroline is gonna make this announcement at PABEA, but wanted to share this as well. And it's related to the legislative session, and I'm just gonna read it. It's EOA Director's request of PABEA for the next legislative session. So just some points, the Gov's office has asked that all departments stand down on any bills that are requesting for new projects or that have appropriation. And that to focus on, we've been really limited this session. The directive was basically, I think, a total of 100 bills for all departments. And I think Department of Health was given 12. So, kind of any housekeeping bills, things like that, they just said, hold off, and especially hold off
Are we
on
part of the
bills.
DOH?
Yes,
Yep.
yes. So yeah, it was 12 for all of DOH and 100 total for all of the state departments. And so no, bills within the gov's office package, no new projects, no appropriation requests, things like that. So, but to focus on, like I said, initiatives that have already been funded through the legislature and get those moving and get those going. So, and this next legislative session will be a difficult one for the legislators, especially with the potential federal funding cuts that's going on. The economy, there's different things going on with our own state economy that we have to take a look at. So it's not going to be an easy session for the legislators. Knowing both the federal and state kind of economic trajectory. EOA's position will be to support the administration and to comment on intent, or we may respectfully oppose any new projects, especially if it's asking EOA to be the lead. This is basically right now EOA's capacity. We're at capacity. We're stretched. We still are trying to recruit for several key positions, like the long-term care planner position. The other planner position, we have long-term care ombudsman that we've been having difficulty, trying to recruit for. So it's a challenge. So having a new project at this point would be very difficult. EOA is still working to implement past legislation. We don't want to lose credibility with the legislature or the public for supporting something that we're not going to be able to complete. So, as the board, in support of the director, Caroline kindly asks that you support her legislative position. She asked that when testifying to please, again, and we've mentioned this, to please wear the hat of the Policy Advisory Board for Elder Affairs. If you do feel strongly about something that pertains to other interests and it's hard to kind of separate the two, then being the PABEA lead on that item or the bill may not be in your best interest. So you do also have the option to testify as an individual without referencing PABEA. So like I said, she's going to go over this as well in PABEA. So just keep that in mind as the bills come out, and we're still going to continue to monitor the bills. But just keeping in mind, we would love to support all of these bills if we had the staffing and the budgetary capacity. But just keep that in mind as you review the bills and consider bills to support as PABEA.
I'm sorry, would you mind, Sarah?
Sure.
Could you review that one more time about wearing the PABEA hat? Yes or no? I wasn't sure I understood what that meant.
So, if you feel, so she asked that when testifying to please wear the Policy Advisory Board for Elder Affairs hat. So if you're gonna testify on behalf of PABEA, and we'll let you know if there's a project, if there's a bill that's specifically asking EOA to do something, we're at capacity right now. We're not necessarily able to take on new projects. But if you feel very strongly about supporting that bill, and you want to support it, you can support it as an individual, but not referencing as a member of PABEA. And then maybe considering, maybe that's not the bill that you want to take the lead on, because if you take the lead on a bill,
Then you represent PABEA.
then you're representing PABEA on that. So consider how you want to support the bill as PABEA. or as an individual.
And so to represent PABEA, then we're going to vote here on which bills and who's covering what. But then we're gonna take that to the PABEA meeting and vote on it there. And if that gets voted in, then we're representing PABEA and executive office agent. So basically preamble is my testimony, if it doesn't happen, does not represent the views of EOA and PABEA. Is how you write that in the preamble, right? So that's what's in the notes here. Okay.
I have one
So-
food for thought, not for immediate action, but the other day, I was very disturbed. I thought university was to educate and train the students for future jobs,
Yeah,
but now that we'll be paying athletes
yeah,
to come to play football or basketball, volleyball, whatever.
yeah,
I think whatever funds should be
right.
directed to like John Burns School and give more scholarships for doctors or nurses, or
Okay,
financial aid, or even
Okay.
social workers. There's such a shortage.
right. So we're gonna wrap up. But yes, there's a national move and it actually passed to pay athletes and they made a request for state budget stuff. Which doesn't apply to us here, other than the fact that it comes from, my wife used to say, the budget is like a pie. And we can't go multi-layered. And Barbara, you've had your hand up for quite a while. What's up? This is Barbara's service. There you go.
I just, well, a couple
Oh, can't
things.
hear you, Barbara.
You can't
You
hear me?
unmuted too. Uh-oh.
Oh.
I'm sorry, we have no volume here.
Yeah, sorry, Barbara, we can't hear you.
Can you put it in chat? No, I'm sorry.
Okay, sorry, don't know what to do.
No.
Oh,
Um,
I can hear you, Barbara.
Can't
Oh.
hear Roberta either.
can you hear me
Oh,
now?
oh.
Can't hear Roberta. Hold on,
Is
I'm
our
not
volume-
sure.
Maybe our volume's not up.
did we hear anybody
You know,
here?
Still
Maybe.
Still supposed to,
I think
hang on, let me see if
Flower and
this will
Powell.
help.
We on?
Just continue.
And are we on?
You can't hear.
You can hear
Barbara
us
or
okay,
Roberta? I
yeah?
can hear Barbara.
Oh, there it is, way down.
Stephen, can you hear me?
Roberta,
yeah,
Barbara,
yes,
when
I
you
can
guys
hear
say
you.
something,
Okay,
we can't.
I can hear
Oh, yeah, I
Stephen.
can't hear anybody.
So, hang on, let me grab, I think this is off.
Okay,
Yeah,
technical difficulties, hold on.
Pause.
Okay, so we'll come back to that just to stay on track so we don't go over. So we all know that the Kapuna caucus 2 o'clock today. So they're gonna announce which 5 bills they're supporting. Our RAC committee meeting, oh, we do need to make a decision here. So I'll wait for her to come back. Our next meeting, we talked about this last meeting, would fall on New Year's Day. So we're looking at meeting on Friday, January 9th, from 9:30 to 11 o'clock. PABEA is gonna meet on Friday the 9th. You guys okay doing our committee meeting here? Okay. And we'll probably, I still have to deal with the RAC. I have a date for that also, but that's separate. Okay, and we'll wait till we get the volume here. Anything else? Okay, we'll wait for Zoomland to be able to log on. Hope I didn't put you to sleep, everybody.
Public testimony. Well, we can't do any of it.
No. Yeah.
Hey,
Hi, everybody,
Hey.
sorry, we've got our tech guru.
We'll unplug and plug it back in.
Oh, I just heard it. Was that one of you guys in Zoom?
No.
Okay, which one is it? Sorry.
If it's not on here, just turn the volume up.
This one. Wait, sorry.
Yeah.
And then just like, yeah. Like,
Okay,
maybe like up to.
Barbara, Roberta, or Steven, when do you guys do a
And you can try to turn the camera.
testing?
Can you hear
Can you hear
us?
me?
Yay! Okay,
Roberta,
guys now.
can you hear Roberta?
Yep.
Yeah.
Cameras.
Oh, sorry.
Yeah.
And just wait a second, should come up. Okay,
Okay, and you guys can see us? Okay,
Yeah.
we can, see you and we can hear you guys. Thank you for your patience.
Okay, Barbara, what's on your mind?
I had a couple of things. When we voted on things a little while ago, or made motions or whatever, Roberta and I both had our hands up and you said, does anyone want to do this? And we had our hands up and you didn't acknowledge that. And I know you can't be looking 6 different directions at the same time. So I guess it's the best thing to do when you ask, does someone want to make a motion, that someone says, I move, and not puts their hand up or puts the red hand up or whatever.
Thanks, Barbara.
Okay.
The
Sorry,
other,
Lucas.
the other thing I'd like to clarify, you said we have to have our real picture, right? Not like Sarah has right now. That has to remain the entirety of the meeting, is that correct?
Yes,
Yeah, if you're PABEA and you're on the committee. If you're not on the committee and you're just joining us.
well, so just to clarify,
so-
board members.
Okay, so Sarah's a community member, so she doesn't have to, right?
Yes,
Correct.
Okay, I just wanted to clarify that. And I went out and you said something about if you have to go, like if you have to go to the bathroom or make a cup of coffee or whatever. I was taught that Zoom etiquette is not to be eating. And that was why I was off for what seemed like an eternity, but I don't know. I didn't eat that much, I didn't think. But anyway, just wanted to clarify that. So
thanks, Barbara.
Eating.
I'll try to eat before the meeting if I wake up in time. Okay.
You're so polite, Barbara.
And Barbara, the way we have it set up now is it spotlights, because of all the Zoom bombing that happened. It
Oh.
spotlights whoever is talking. So if your stuff is muted and you're eating, you're just kind of up top, kind of on a gallery view. So don't worry, it's
Okay.
not highlighting you eating, chomping away. So you're okay.
Okay,
Unless you're
Thank
unmuted and you're a loud eater.
jump. Okay, got it.
Roberta, were you gonna ask something? Okay, thanks, Barbara. Anybody else out there before we wrap her up?
Steven?
Steven, did you have your hand up?
No, nothing for me. Thanks.
Okay. All right. Well, thanks everybody for joining us. Is there anything else?
Sorry, the new business. What did you decide with the January meeting date?
Oh, January 9th,
We'll
Okay,
line
so-
up.
9:30 to 11 o'clock.
Just so you
That's what you
guys
said,
know,
Paula.
I'm not gonna be here, but Jason will be here.
Okay.
And he'll be able to solve all the tech stuff
Okay.
very quickly, so.
Okay. And then new business, I just say it again. So if you have something that you want on the agenda, please get it to me, because when I make the agenda up and Christina, once it's posted, it's locked in. Okay?
And by the middle of the month,
Yeah.
so get it to Rick by the middle of the month. Email him, let him know.
And that's
Okay.
nice for me. It's a
So
reminder.
what, point of clarification then, for the January meeting, Rick,
Yeah.
will you then be going around the room, so to speak, to ask people to sign up or indicate which bills they want
I think,
to?
Roberta, what we'll do is we'll ask if they've come up with anything that they want to support, but we still won't know what's introduced yet.
Okay,
And even more so because what you just presented, the financial thing going into next year is a huge wrinkle, right? A little bit like when we went into COVID, and then also when the fire behind, I mean, so we've had a few times we've gone around with this.
got it.
I'm not sure what's gonna get introduced. So definitely, Roberta, I think the February meeting, we definitely wanted just target that that's when we make our final decision. But if you've heard something today, because I tried to put a lot out there, I'm sorry, it might have been too much for some, but if there's something in there that you feel passionate about, this is a good time to start looking into what's gone on with that already and what maybe is going to happen going forward. I'll kind
Got
of,
it. Thank
that
you.
was my hope today. And then we'll get more fine tuned as we go forward because we'll have very specific bills that we're working on. Right? Okay.
I just
And there may be,
want to add, in terms of the legislative calendar, so at the next meeting, I'll have copies, regarding the legislative calendar and any other kind of,
yeah,
related legislative info that might be useful to you folks. But keep in mind that the legislative session, 2026 session starts the third Wednesday of January. And I don't know I think it's
The
22nd or 23rd,
21st.
21st. So Wednesday, January 21st is the opening session of the 2026 legislative session. And the bills will be introduced and it's about a week. And then the cutoff date of bill introductions. And
January 20th.
literally probably within the week or two following that, the hearings will start. So keep in mind the timeline, it's very tight and it's doesn't always align with when we have legislative committee meetings. So some of those first testimonies may not get out right away, maybe the second testimony. But once the hearings start and those notices start, I'll get those to you, but keep in mind again, testimony is 24, 48 hours sometimes. So just keep that in mind that we may, depending on what you guys may want to have a special meeting to set what those bills are. So that for the February, you can say, this is what we would
Right.
like PABEA to approve.
Because otherwise it'll be March before we can vote.
Yes,
With
so
the
so keep
sunshine.
that in mind with the time.
I'm sorry, what was the date again on that?
So, January 21st, Wednesday,
Okay.
the third Wednesday is always the opening day. And then 1 week after that, usually bill introductions end. And then a week or two, the hearings start. And so you guys may want to consider having a special meeting to determine.
Yeah. So we'll know the
bills.
Kapuna bills because those will be presented today. So we'll have those 5 that we'll know for sure today that you guys can consider, and then the rest will play out as we go along. Right. So again, with sunshine law, we happen to have things posted how far in advance? 2 weeks?
Well, we have to post it 6 business days
Okay,
in advance,
okay.
but it
Is-
takes us, a couple days or so to fine tune the agenda or
Yeah.
whatnot. So it's very helpful by the 15th,
Yeah,
or middle of the month.
right. So it slows us down. And the session ends by the end of May, right?
Yeah, and once it's posted.
End of
you
April.
can
1st of
retract
May.
it.
End of April, 1st of May. Yeah,
So.
so there's a little bit, not much wiggle room, so. So maybe as part of new business, maybe we here want to just kind of agree that when the bills get introduced, we probably will schedule a meeting to talk about them. Get it posted within the 6 days. So I always say it takes 2 weeks to get it posted, but we could set something up and so you're not gonna fly over here. We'll just do it on Zoom.
We did it, I think
Yeah.
last year
We
it
did.
was done by Zoom.
Right, Barbara?
Yeah.
We did that last year, right?
And we can call it a special meeting.
Yeah.
Or-
So if everybody's okay with that, we'll call a special meeting once the bills are actually introduced to take a look at that. And thankfully, we got Christina here to help us.
Rick, I have a question. Does the bills that Kapuna Caucus is going to tell us about today, are they bills? I thought they were just sort of general ideas.
I think the bill,
Make it into those.
they're gonna make them into bills and then both the chairs will introduce them. So
Okay,
Sharon
so-
Markowski,
so
unless
they're-
somebody,
they're not necessarily bills yet.
They work with whoever proposed it to create the bill.
Okay.
Usually Senator Moriwaki's staff will kind of finesse it so that it's an actual bill.
right.
Thank you.
If it's something that makes more sense to be a resolution, it won't be one of the 5, but it will be on their list that they check on with us.
LRB and AG have to look at the bills too.
Right, yeah,
But then deal with it, just the legislature.
okay.
Okay, thank you.
Important the caucus meeting this afternoon, so. All right, and with that, then we're gonna have a PABEA meeting at 12 o'clock. It's gonna be an abbreviated one and then lunch, so if you guys in Zoom wanna get over here for lunch, it's not on Zoom, right? The PABEA.
They certainly are.
I'm not sure.
I
I
thought-
I think, well, I think it
Oh,
was an
one email.
in-person meeting. I
Yeah.
thought it was in
I
person.
think it's in person only is what I read, but. Don't.
I move that we adjourn.
Yeah.
Okay, anything else, anybody? All right, so we'll adjourn at 11:04. Thank you for your time.
Aloha.
Aloha, happy holidays.
Yeah,
Happy holidays.
Kalikimaka.
All right, well, thanks for hanging in there.
Do some work from here.
Pros and cons of.
Are you joining us for lunch?
I think so.